All right. So when you're starting off a hip eval, you're gonna want to compare everything bilaterally again. Make sure there's no ecchymosis, any bruising, any sort of physical deformities. Then you're gonna want to start with your palpations with all the bony landmarks. You want to start up top with the iliac crest up here. Move to the ASIS. Move your way down to like the anterior thigh right along the quads, the greater trocaners on the lateral sides. You're also going to want to palpate the IT bands as well, and check for any tightness there. Can you turn around for me, please? All right, you also want to check the PSIS back here. All right, you can also check all the way down for the coccyx too. You want to check the glutes, hamstrings as well. Palpate for any tightness. You're also going to want to check for the ischial tuberosity too. Check for any bursitis. Okay. So from here, you can have your athlete or your patient do some functional testing too. Have them walk down and back. All right, you're checking for any gait abnormalities, any sort of limps, and you can have them walk back on their heels, walk back on their toes as well. Do a couple squats. Do that. Okay. And then you can check the range of motion. We don't have a table to work with, so checking hip flexion. You're just gonna have athlete raise their leg. Okay, for active extension, have them move their leg back. All right. For hip adduction, they're going to move their leg laterally. All right, and the adduction, you're going to come across. Okay, and from here we can do passive and resistive range of motion as well. Okay, so just relax this leg. All right, then you can move your athlete passively into flexion, and then back into extension. All right, this is easier done on a table, but this will do just fine. All right, then for resistive range of motion, have them move into flexion, give them some resistance. All right, give me some resistance up top. I'm going to push you back down. Not that much resistance. Okay, have them extend. We can do the same thing. Okay, move your leg back. All right, give a little resistance coming back. Okay. All right, we can do the same with hip adduction as well. All right, just relax. All right, and we can do that with adduction as well. Okay. We can move on to resistive range of motion. All right, hold that, let me push back. All right, and adduction as well. All right, you can do break tests out of this too. Just give them a little bit of slight into adduction. All right, don't let me break you out of this position. Okay. Yeah, we can do that with adduction too. All right, don't let me break you. Good. Okay, then we can do, all right, you can sit in that chair. Please and thank you. All right, we can test internal and external rotation too. All right, so for active range of motion for external rotation, you're gonna have your athlete just set their ankle right on their shin or right on their knee. Okay. All right, and for internal rotation, just rotate and try to flail out your, it's so awkward. Okay, then just have them relax, and then you can do the passive range of motion for them. All right, that. Then resistive, just give me some pressure on that. Okay. All right, and then you can do the same kind of break test as well. All right, hold here, don't let me break out of that. Okay, move the other way. Good. Okay, move from here, we can do some special tests. All right, so have your athlete lay down from here. All right, you start by doing a Thomas test. So you're gonna have your athlete pull a knee up to their chest. And then you're gonna check to see if their other hip comes off the ground. And what you're looking for is, like, if the hip comes off, that's a sign of tightness in their hip flexors. Another test you can do that's indicative of degenerative hip issues is a hip scouring test. So you're going to have your athlete at 90 degrees. Apply pressure into the hip joint. And you're just going to rotate internally and externally. Sorry, it's up. All right, another test you can do is a Patrick Faber test. You're going to have them in a figure 4 position. You're going to apply pressure down on the knee. No. We can also do a piriformis test. So you're going to take that leg at 90 degrees, externally rotated. And you're going to push up. All right, and if they have any signs of piriformis syndrome, this can elicit pain in the piriformis. All right, and another test we can do is the Eval test. You flip on your stomach, please. And for this, you're going to bring you're going to flex the knee. And what you're looking for is the hip to come off the table, come off the floor. And this is an indication of hip tightness as well. Okay, thanks, babe.